Sometimes the biggest breakthroughs, they're not complicated at all. They're actually super simple. And that's exactly what we're talking about today. It's a story that kicks off with a pretty nasty insect and ends with a simple checklist that totally changed the game in emergency medicine. All right, let's get into it.
Okay, so here it is. This is the bad guy of our story, the Vespa velutina, or as you might know it, the yellow-legged Asian hornet. In the region of Galicia, Spain, this little insect became a huge problem. We're talking a major public health scare because its sting was causing a massive spike in really severe allergic reactions. See, when one of these gets you, your body can just freak out, go into complete overdrive, and that's when you've got a life-threatening emergency on your hands.
So here's how we're going to break this down. First, we'll look at the sting itself. Then, we'll get into what was going wrong in the emergency room. After that, we'll introduce the solution they came up with, Code Anaphylaxis, see how well it actually worked, the good and the not so good, and finally, we'll zoom out to see what this whole thing can teach us.
All right, first things first, let's talk about the medical side of this. What's actually happening in the body when a simple insect sting turns into a full-blown life-or-death situation?
The official term for this is anaphylaxis. And you really got to focus on those two words, severe and life-threatening. We're not talking about a little itchiness or a rash here. No, this is a systemic, whole-body meltdown. It can make your throat close up, your blood pressure can just completely tank. It's the real deal, and it requires a super fast, super accurate medical response, like right now.
Okay, so you've got this incredibly serious condition. You'd think the emergency response would be a well-oiled machine, right? That everyone would know exactly what to do. Well, it turns out that wasn't exactly the case. A study in Galicia looked at the data before 2021 and found some pretty big and honestly pretty scary gaps in how these patients were being handled.
It was like the whole system had holes in it. The most important life-saving drug, adrenaline, it wasn't being used consistently. A really important blood test to confirm what was happening often skipped. And getting patients to a specialist for follow-up, it was taking way too long. It was clear that the safety net had some serious tears.
So to plug these holes, they did something really smart. In September 2021, they launched a brand new protocol, and they gave it a powerful name, Code Anaphylaxis. And this isn't a new idea, really. They borrowed it from other emergencies you might have heard of, like a code stroke or a code sepsis. The whole point is to have a standardized playbook, so every single patient gets the absolute best care as fast as humanly possible.
And the goal itself was beautifully simple. It boiled down to three things. 1, make sure every doctor, every nurse can spot anaphylaxis instantly, no guesswork. 2, give them a clear step-by-step plan for what to do next. And 3, make sure that after the emergency is over, the patient gets to a specialist quickly and efficiently. Standardize, standardize, standardize.
Okay, so that's the plan. The big question is, did it work? Was this simple checklist the magic bullet they were hoping for? Well, researchers did a classic before and after study, comparing a couple of years of data on either side of the change. So, what did they find out?
And right off the bat, the results were, well, pretty stunning. You remember that special blood test we mentioned, the tryptase test? It's super important for confirming a diagnosis. Before this new code, less than a quarter of patients were getting it. But after the code, that number shot up to over 50%. That is a huge leap in getting the diagnosis right.
Yeah, I mean, just look at that difference. This wasn't some minor adjustment. This was a total game changer for the standard of care in that hospital, all because they put a simple, clear plan in place.
And the good news just kept coming. Getting that follow-up appointment with an allergist, the wait time was basically cut in half. It went from a median of 20 days all the way down to just 11. And you have to imagine, if you've just had a near-death experience, getting answers and a plan for the future that much faster, that is a massive, massive relief.
What's really interesting, though, is that when they dug into the data, they saw the code helped different people in different ways. For patients over 60, the biggest improvements were in getting those diagnostic tests and seeing a specialist faster. But for the younger crowd, under 60, the main benefit was that they were more likely to go home with an adrenaline auto-injector. So the code was a win for everyone, just not in the exact same way.
But it wasn't all perfect. The study was honest, and it pointed out a really big problem. There was one critical area, you could argue the most critical area, where the code just didn't move the needle.
So yeah, lots of good stuff happening, but did the code solve everything? The answer from the data is a clear and kind of concerning no.
This is what I'm talking about.
Look at the numbers for intramuscular adrenaline. This is the #1 most important life-saving treatment for anaphylaxis. Before the code, it was used in about 47% of cases. After, it only crept up to around 52%. I mean, statistically speaking, that's barely a change at all. Think about that. Even with a clear protocol in place, almost half the patients who needed this critical medicine still weren't getting it.
So what gives? The instructions were clear, so what was the problem? Well, the researchers who wrote the study have a theory. They think it comes down to something a checklist can't fix: human psychology. They said there's still a need to help health professionals overcome their fear of prescribing it. And that's fascinating, isn't it? It shows that sometimes a gut-level fear or hesitation can be more powerful than even the clearest set of instructions.
But let's not lose sight of the bigger picture here. Even with that one really significant hiccup, the overall story of Code Anaphylaxis is a huge success, and it offers a powerful lesson, a blueprint really, that applies to way more than just insect stings in one part of the world. You see, this whole idea of calling a code is one of the most effective things we have in modern medicine. Think about it. In the total chaos of an emergency room, when someone's having a stroke or a heart attack, that code brings instant order and focus. It saves lives every single day. And what this study really proves is that anaphylaxis absolutely belongs on that list. It needs its own code, its own universal playbook. So really, the big picture lesson here is just how powerful simplicity can be. The world of emergency medicine is incredibly complex. It's high stakes. It's chaotic. But sometimes all you need is a simple, clear plan to slice right through that chaos. It can literally be the thing that makes the difference between a patient falling through the cracks and a patient being saved.
And that kind of leaves us with one final question to think about, right? We've seen how a simple code has revolutionized care for heart attacks, for strokes, and now for severe allergic reactions. So, what's next? What other chaotic, confusing medical emergencies are out there right now, just waiting for a simple checklist to turn that confusion into clarity and ultimately save more lives?